Have you ever had pain that goes down your leg or in your buttocks and travels down the back of your leg and into your foot? Or pain when you cough or while you're sitting on the toilet, it hurts and you start to feel numbness and pain down your leg? Well, we're going to talk about that today. That's oftentimes called sciatica, and we're going to talk about what might cause these symptoms and how you can deal with it. Hello, my name is Jeff Peterson. I'm with Peterson Physical Therapy. Here at Peterson Physical Therapy, our promise is with unconditional positive regard, we promise to meet patients where they are and help them move forward. And today, as part of meeting patients where they are, we'll talk about some of the things that can cause the symptoms of sciatica. A lot of people are diagnosed with sciatica, and it basically means pain that radiates down the back of the leg from the buttocks into the hamstrings. And there are several things that can cause that. So we're going to talk about those things, and towards the end of the video we're going to talk about ways that you can try to figure out if you do have one of these issues. There are several things that we won't talk about, but we can help you tease out whether or not you have them, because some of them are more serious and some of them are more stable than others. So basically, if you read our last blog, the 5 things that can cause the symptoms of sciatica include a disc problem, and we'll talk about that, a joint problem, so the joints in the low back, a muscle problem, particularly the piriformis muscle. Many of you might have heard of the term Piriformis Syndrome. A condition called Spondylolisthesis, which is a slippage of the vertebra, and then spinal stenosis. So we're going to go through each one of those and talk about ways to determine what they are and ways to determine whether or not you might have that. So the first one we're going to talk about is a disc problem. So there are several problems you can have with a disc. The worst one would be a complete prolapse, where the material from the disc squirts out and compresses the nerve root. To help us understand this more, I want to show you a picture of that. So when we talk about the disc, and I'm going to show you an illustration of it, and then we're going to look at the spine. So the disc is a cushion, or acts as a cushion between 2 vertebrae. So you see this vertebra here and this vertebra here, and it acts as a cushion. When in reality, the way it's designed is it's a ligament and a cushion. The outer part of the disc acts like a ligament, and it prevents the vertebral bodies from moving back and forth, or what we call shearing. The inner part of the disc is the same material, but it's not as uniformly oriented, and it creates the cushion so that you maintain optimal space between the 2 vertebrae. And what can happen is if the outer part, this darker blue part, starts to break down, then that fluid will push out and oftentimes hit the nerve. And you see a nerve root that comes out from the spinal cord, and that nerve root can create a lot of pain down into your leg. Let's take a look at that in the vertebra here. So this is our pelvis. This pelvis has had a little bit of abuse over the years. So the lesson is don't abuse your pelvis. But looking at this one here, we've got, these don't depict the actual disc the way it's designed. There's usually 12 to 16 layers of a ligament on the outside, and then the inside is what maintains the spacing for these joints right here. We'll talk more about the joints later on. So how do you know if you potentially have a disc problem? Well, you can go back, I want you to go back and look at one of my videos where we talk about the severity of the pain is not always directly correlated with the intensity of the pain with the severity of the problem. And the disc is a perfect example. A herniated disc is not a condition that will kill you, but it will make people want to die because of the intensity of that nerve pain and the consistency of it. So one way you know that you have a disc problem or you have some discogenic pain is when you increase your abdominal pressure, like you're bearing down, oftentimes using the toilet, that'll cause that pain to go down your leg. A test that we do is a compression test where people stand on their toes and slam down hard. That can create some pain. If the pain is worse, first thing in the morning you get up to move around and the disc is imbibed with fluid because you're in a recumbent position, so there's more fluid to press on that nerve. that's another sign that it potentially could be a disc problem. So you want to keep an eye on those conditions. If you're just in miserable, intense pain, that's another sign that it may be a disc problem. So in any of these conditions, if you have any questions, you certainly want to see your doctor or your physical therapist. And if you're in our area and we can help you, feel free to call us or send us a message on Facebook. The second condition that can contribute to sciatica symptoms that we're going to talk about is the piriformis muscle. The piriformis muscle, and if you look at this model here, you can see this represents the sciatic nerve. With all these nerve roots will come out of the spine and then rejoin into one big nerve that passes in the back of your hip in your gluteal area. As a matter of fact, deep gluteal syndrome is another term that people are starting to use to refer to pain in the buttocks like that are related to the muscles, not simply the piriformis. Piriformis syndrome is a term that we've used for years. The piriformis muscle, I'm going to show you a picture of that. We're looking at the back of the pelvis now here, and you can see the piriformis muscle comes off the sacrum, a little bit high on the sacrum, and then comes over to the greater trochanter, or the hip point that you can feel on the outside of your hip. In some rare cases, this sciatic nerve actually runs through the piriformis muscle. In other cases, it runs adjacent to it, and tightness and spasm or guarding of that piriformis muscle can irritate and facilitate the sciatic nerve, which will give you pain down the leg. So one way you can assess that is by stretching the piriformis muscle. So some of the symptoms are pain with excessive walking. So you wake up in the morning and maybe it feels better. You start walking around, or you're sitting on a hard chair, or you're sitting in a chair at work, and as you sit longer it increases the pain, starting in the buttocks and then into the hamstrings. Hamstring guarding can be another sign of that. One thing you can do is stretch it. One of the stretches you can do is you're sitting on the table, you put your knees together, and you roll your hip out. So you're internally rotating your hip. That muscle works to externally rotate your hip when you're standing. It can also work to help, so when you're standing, it externally rotates your hip. So if you internally rotate it, you're putting stress on that muscle, and that might indicate that it's the piriformis muscle. The other thing that can really help us is specific point tenderness right in that area. And in another video, we're going to go over some exercises, and we show you how to stretch that piriformis. In previous videos we've talked about how to monitor your posture, because posture is key with any kind of back pain or any kind of sciatica. So go back to our videos on proper posture and sitting at the computer correctly, because that will help. The third thing that can contribute to sciatica is a joint problem. So when we talk about joint problems, and this may be a good time to tell you our PT joke. You know how you keep from getting stiff in the joints at night? You just don't go into them. It's the only way that's ever worked for me, but that will be another video. So, Jeremy's like, that's enough of that. So the joints, we have the vertebra, we have the disc that separates the vertebra. The back part of the vertebra, you see these projections of bone that serve as attachments for muscles and ligaments. And then one vertebra, each vertebra will send a slip up of bone up, and one will send it down. And where they articulate is a joint. There are two joints on each side. Those joints are just like your elbow joint or your shoulder joint, in that they have a joint capsule. There's a little meniscoid in there, and they're lubricated by synovial fluid. Now what happens is sometimes those joints can be worn out and you can develop some arthritis. Well, if you develop arthritis and you develop extra bone growth, you can see the nerve root that comes right out of this area here, which is the neural foramen. That neural foramen allows that nerve root to pass unobstructed. If this joint has extra bone growth and it creates a little bit of a spur that irritates or tickles that nerve root, it can, and particularly down low in the spine, it can create the symptoms of sciatica. So that's a little bit difficult to tease that one out. One of the things that we do know is if you have more pain in standing, and when you're in extension, that's a sign implicating the joint more than the disc. When you have less pain when you're rested and you wake up in the morning and it feels a little bit better, but as you're standing more and arching your back, that could suggest the disc. And when there are some very specific movements, so when we assess someone in physical therapy, we look at bending to the side, rotating, flexing, and extending. When there's a pattern of movement that is very specific that causes that pain down the leg, then that might suggest the joint. Another thing that can cause sciatica symptoms is stenosis. So when something is stenotic, it gets rigid. So there are two areas of stenosis that can occur. The first area is in the neural foramen. So stenosis just implies that little passageway created by the vertebrae setting on each other is narrowed for some reason. Now that could be from a bone spur, that could be from extra bone growth, it could be from a postural issue or a slippage of the vertebra itself. But anytime that neural foramen is smaller in size than it might be, that is considered stenosis. The other area of stenosis happens where the spinal cord runs. And if you could hand me we're in a debate whether or not this is a cow or a whale vertebra. We certainly know it's not human because of the size of it, obviously. But the area that I want you to look at is the spinal cord runs in this area here. And then you stack another vertebra on it and another vertebra on it, and it creates a tube for that spinal cord to run. Anytime there is a decrease in that space, the spinal canal, that's considered stenosis. Now, some people have stenosis because this bone grows and it gets kind of thickened. There's a ligament that runs in the back here. Sometimes that ligament gets thickened, decreasing the space. And then sometimes there is a shifting. If you imagine I'm stacking one of these on another, if I shift this one here, that could decrease the relative space for the spinal cord to pass through there. So that's spinal stenosis. When you have spinal stenosis, whether it's in the neural foramen or particularly if it's in the spinal canal, one of the things that we notice is that the posture presents with a flattened spine because people want to increase the space, and unconsciously they start to flex their spine. So what increases that pain is when you go into full extension, prolonged walking. The symptoms people will have is particularly bilateral symptoms, not just on one side of the sciatica, but on both sides, where the hamstrings get tight and they feel the spasm in the hamstrings. And then the final thing that we're going to talk about is spondylolisthesis. Spondylolisthesis is basically a term that refers to a slippage of the vertebra. So if you look at this vertebra here, you can see, and we're going to go down to L4, 5. So they number these vertebrae. We've got the sacrum 1, lumbar 5, lumbar 4, 3, 2, 1. So when you see in your medical report L1, L2, that means lumbar 1, lumbar 2, etc. When you have lumbar 1 and 2, that creates a segment that moves. Okay? So we're going to look at lumbar 4 and 5. So if you look at between lumbar 4 and 5, there is this facet joint. Now what can happen is if there is a defect in the bone or the lamina that connects this inferior facet with the superior facet of L4, if there is a fracture in here or a congenital anomaly where it didn't form properly, or a degenerative fracture, then the L4 can literally shift forward on L5. That creates a stenosis where the spinal cord doesn't have as much room, but it also can create a stenosis or a decreased space in the neural foramen, and that can give you those symptoms. We see that a lot in former gymnasts and dancers who tend to arch their back a lot. Again, that's another condition that is noted by bilateral symptoms as opposed to unilateral symptoms, and particularly when arching the back. The The only true way to diagnose that is with a very specific x-ray. So your doctor will take several different views, but particularly an oblique view where they can look at that lamina and make sure that it's intact. But there are ways to treat that. And the research is clear. If I have a good, strong, stable spine, good, strong, stable hips with flexibility in my hamstrings and my hip flexors, that is how you decrease the likelihood that a spondylolisthesis is going to create pain down the legs or pain in your back. So staying strong and stable is really helpful, and we're going to do some videos on how to do that. So those are the causes of sciatica. Why is it important to know what might be causing it, and why is it important to see somebody? Depending upon what causes it is going to determine how you treat it. Again, our promise is to meet people where they are. It's important for us to know where they are to help them move at least 1 or 2 steps forward. So if it's caused by a herniated disc, that's a very different condition than if it's caused by a joint problem. Also keep in mind that you may have more than one of these things going on at the same time, depending upon your age and the amount of stress that your spine has taken. We see several people that will have a combination of things. So we want to be able to be as specific as we can with the diagnosis. Rarely are they just isolated to one tissue, but we want to target that tissue and target the mechanics to help you get out of pain and get back to moving. So hopefully this was helpful. If it was, subscribe to our YouTube channel, like our Facebook page. Feel free to send us a message on our website or Facebook, and we'll get back to you as soon as we can. Thank you.